This is a pressing issue in Papua New Guinea, tobacco use. More than just a habit, it's a challenge woven into daily life, affecting families, communities, and the nation's health system. From cancer and heart disease to the economic strain on households, the impact is far-reaching. And with young people increasingly exposed, the cycle of addiction continues.
It is known to contain about 600 ingredients, and these 600 ingredients, without burning, once it's being lit up, it has about 7,000 chemicals. And of these 7,000 chemicals, about 89 have been known to cause or lead to cancer. And so that's the danger of tobacco once it's being lit or burnt. And when we consume, because some of these chemicals are like tar, which are used for the pavement or roads, even lead that we see in batteries or fuel, acetic acid that's in the hair dye, even ammonia, that for household cleaner. And so there's many nasty chemicals that are in the tobacco smoke once it's being lit. And when we consume or breathe in, directly as primary consumers of the smokers, we get it into our body. And because it's lit, and now it's, when the smokers exhale, or when the smoke is being produced, and whoever is next to them, the passive smokers or secondary smokers, they are also exposed to the same chemicals. And the same effect that is going through or affecting the smoker itself can also be felt by those around them as well, the longer they're exposed to people smoking. And these chemicals, mind you, are not safe. And they can, and then some of them, like I mentioned earlier, as we were touching on about addiction, they get the peasant consumer to want to smoke more. And so they get them to, after they finish the smoking, the hunger or the desire for smoking is there, so they look for another one to consume or light up and then consume or smoke.
Chief Physician at the Internal Medicine Services with the National Department of Health, Dr. Bola Watoka, emphasized the serious medical impacts of tobacco use while highlighting the vital role his department plays in protecting public health.
Looking after adults, or we are concerned with health of adults. These are not including pregnant mothers. Of course, they will be looked after by the obstetricians and the gynecologists, but for non-pregnant adults, starting from ages 14 all the way to, so from as young as 14, but otherwise we look at the ages above that. So that's the age group that we look after. In terms of, and so we basically look at in prevention of or looking after patients in terms of prevention of our people not to get sick, also to try and diagnose and treat as well, and also follow-up of patients. The variety of cases we see ranges from conditions that we call them that are caused by germs or infectious diseases or communicable diseases, and examples include tuberculosis, malaria, HIV, and the other infectious diseases, to non-communicable diseases, common ones like diabetes, hypertension, stroke, even cancers, chronic lung disease. So those are the variety of cases that we see. And if you break it down into organs, it's from the head to the toe, just like a surgeon or just like a pediatrician. So we look after conditions of the head, like stroke, conditions of the eyes, even the lungs, the heart, our digestive system, and even the joints and bones as well, and muscles, and a few others. Internal medicine, we are concerned with adult health, and the age group, as I mentioned, is from 14 years and above, non-pregnant women included as well. Now, like I said, we deal with when adults are in that age group, they come in, condition affecting the heart, lungs, and liver and kidneys. So we have internal medicine doctors, general internal medicine doctors or physicians. In Papua New Guinea, we refer to them as physicians, or in other countries, they refer to them as internists. Now, under this general pool of internal medicine doctors, there are also doctors in internal medicine who specialize in the different areas. For example, doctors who specialize in the area of lungs, we call them pulmonologists. Doctors that specialize in the area of heart care, we call them cardiologists. For the brain, we call them neurologists. So different areas of the body, there are specialized doctors for that. So in the country, like currently, we have cardiologists here in the country practicing. We have nephrology specialists that look after the kidneys, and also stroke as well, and also endocrine problems or problems related to hormonal problems, diabetes, thyroid problems of the neck. This fall under the scope of internal medicine doctors. So those are just some of the specialists that are physicians, but they deal with certain areas of the body specifically.
Tobacco use harms the body in multiple ways. It attacks the lungs, causing chronic bronchitis, emphysema, and lung cancer. It strains the heart and blood vessels, leading to high blood pressure, heart disease, and stroke. It weakens the immune system, leaving the body more vulnerable to infections like tuberculosis.
Tobacco is still a concern to us at the department level, and even it's a cross-cutting issue, mainly because of its health impacts, but it does have an impact on the socio-economic status or well-being of our people, and so it is a big challenge for our health system as well as the government, not only in PNG, but it's all across the world, because tobacco is a major issue. And as you mentioned as well, it is not only the adults that we see, the use or consumption of tobacco has gone down to our younger population as well, particularly teenagers in the population. So that's a concern, because if they continue to engage or be consuming this product, obviously as they progress in life, which I will elaborate further on later on, it will have very compound or significant impact on their life, or even the health status as they age on and move into the adult years.
Building on this, Dr. Watoka underscored the National Department of Health's commitment to tackling tobacco's impact. He noted that Papua New Guinea is a signatory to the WHO Framework Convention on Tobacco Control, a global agreement that strengthens awareness efforts, supports reduction strategies, and guides the banning of harmful tobacco products.
Well, yeah, 12% of deaths every year occurs from tobacco. And so every year we see about 8,500 cases of patients being killed from the use of tobacco. All right, so that's about 8,500, and these deaths can be from any cause, but they are tobacco related. So if you look at 8,500 deaths in a year, that's roughly about 1% every hour dying from, or 20 years. So 1% every hour dying from tobacco related deaths. So it is quite worrying. Apart from suffering from the effects of tobacco in the health space, we also note that 3 to 7% from surveys done of the income that is earned by our everyday Papua New Guineans, majority of them is spent on tobacco use. So which is more like a waste, or investing in the wrong thing. I put it like that. This money could be better spent on health, better spent on education and other activities, or priority areas that could improve our standard of living in the country. But unfortunately, about 3 to 7% of our money is spent on tobacco. So it is a concern, and the department, as I mentioned, is taking a serious step in this. And so, for example, we last year, our honorable minister for health imposed the law on banning of vaping electronic cigarettes. So that's something that's taken as serious. We are serious in this business because of its impact, and because the government has also realized that about 787 million kina, PNG kina is being spent, or is costing the PNG economy, to attend to tobacco related health problems. So this condition that I mentioned, they cost our people and the government around 787 million kina every year. Okay, so what we are doing now is that, for your information, Papua New Guinea is a signatory to the World Health Organization Convention on Tobacco Control, or WHO FCTC. What this body does is through a technical guidance package called MPOWER, MPOWER. It's a technical package that helps country to implement effective evidence-based measures to reduce tobacco demand and reverse the global tobacco epidemic.
But there is hope. Through stronger awareness, community action, and firm regulation, we can begin to shift social norms and protect future generations.